Greetings students, today we are going to learn about one of USA's leading healthcare company, Cardinal Health. Let us know this company in a much better way. Cardinal Health Incorporated is a Fortune 500 healthcare services company based in Dublin, Ohio. The firm specializes in distribution of pharmaceuticals and medical products serving more than 60,000 locations. The firm also manufactures medical and surgical products including gloves, surgical apparel and fluid management products. In addition, it operates the nation's largest network of radio pharmacies.
I did incur a needle stick, and I still bear the scar today of a needle stick from a customer syringe that came back to the radio pharmacy and was processed in the waste system, but had that needle sticking out through the cardboard container, and I caught it and got put through the trauma of testing and notification and the uncertainty and concern that placed upon me and my family.
I feel responsible to the patients here by creating a great environment for my staff.
My department and the patients that come in and out of my department, they're all my responsibility.
I think I feel responsible for all aspects, whether it's patient, my staff, or myself.
It is incumbent upon the medical industry to make as safe a product as possible for the physician to use, but also for application to the patient.
With the doses, we have our secure safety insert, which is effectively a mini sharps container for each dose that allows the customer to have, first of all, a clean, nice place for the dose when it arrives, and then once they've used the dose and it's biohazardous, to allow that to function as a separate container for the waste.
With the unit dose that we receive and the seal-tight systems they have for use spent syringes, it reduces the likelihood of needle sticks dramatically.
As far as our technologists are concerned, we want to make sure that they handle with the radiation as minimal as possible so they keep their doses low. And again, for the patient, the certain protocol, the right radiopharmaceutical for the patient keeps the patient safe as well as far as keeping their radiation dose as low as possible.
They have wonderful lead shielding with the pigs and the containers and things that they bring the doses in. So that decreases our exposure since we're doing this time again, time again, time again.
Exposure is a big key topic these days, and for good reason. We're very concerned about what dose people are receiving. So being constantly aware of the level of activity that you're using, what your colleagues are doing, making sure they're using the appropriate safety equipment.
In nuclear medicine and PET, there are standards that we must achieve. We go over and beyond those standards.
You know, the ballpoint pen and the legal pad are great tools, but they're outdated today. In nuclear medicine, there are many great resources available to help a department maintain their compliance. One of them is Syntrack integration tools.
We want to make sure that we are following all of the NRC guidelines. We are following all of the guidelines that are set forth by a lot of different societies to make sure that our patients are safe.
Society's American Society of Nuclear Cardiology has pushed forward certain things that we can do that kind of help decrease radiation dose to the patients while maintaining the same image quality. So I think that's one of the big issues in our work. Since we are nuclear medicine, and intrinsic in nuclear medicine is radiation. So.
We have a radiation safety department in nuclear medicine, and they come down to the department and they sit down and they talk to the patient and they tell them what they need to do when they leave here.
Founded in 1971 as Cardinal Foods by Robert D. Walter, it was initially a food wholesaler. After acquiring the Bailey Drug Company in 1979, it began wholesaling drugs as Cardinal Distribution Incorporated. Following the introduction of the company on the NASDAQ stock exchange in 1983, it began a long string of acquisition and mergers. It is now traded on the NYSE under symbol CAH. As of April 2010, it was ranked 17th on the Fortune 500 list with 2009 annual revenue of over $99 billion. The firm employs more than 30,000 people worldwide. In 1995, Medicine Shoppe International, St. Louis, 1970, the country's largest franchise of retail pharmacies was acquired. The merger represented the first non-distribution acquisition by Cardinal Health. In 1997, in competition between Cardinal Health and McKesson Corporation, Cardinal Health planned to purchase Burgeon, to which McKesson responded with a bid to purchase AmeriSource. Instead, AmeriSource and Burgeon merged into AmeriSource Burgeon. In April 2006, purchased Niagara Falls, New York-based Permat Pharmaceuticals for $40.1 million. Permat, which had been owned by Alpharma Corporation out of Fort Lee, NJ, has a main office in Niagara Falls, New York, and staff in West Seneca, New York, and Jamestown, New York, for a total of 120 workers. The company's primary customers are retail or independent pharmacies. Permat's focus of selling medicine in smaller quantities complements Cardinal Health distribution to bigger hospital and drugstore chains. In 1999, the firm acquired the Chicago-based medical products manufacturer and distributor Alliance Healthcare, formerly a division of Baxter Healthcare. Alliance made surgical drapes, globes, and gowns and distributed customized arrangements of medical supplies called custom sterile packs and procedure-based delivery system. In December 2010, the company acquired Kinray, one of the last independent pharmaceuticals wholesales in the United States, increasing Cardinal's presence in the independent pharmacy market by 40%. Kinray had annual revenue of over $3.5 billion and served about 2,000 independent retail pharmacy customers.
The Pre-Source Promise
is our commitment to you. Commitment to you.
Commitment to you. It is the foundation for how we will operate.
It is what you should expect.
And what you will receive.
It's what makes us
more than just a pack provider. It is what makes us a resource.
We will exceed your expectations.
Proactive, accessible, and visible sales representative.
Collaborative partner that understands your needs.
Documented procedure cost management.
Innovative solutions to support safety and infection prevention.
Straightforward pricing.
Ongoing assessments to drive continuous improvement. High service levels with no unauthorized substitutions.
Clinical and logistical support. Ongoing focus on supply chain process improvements.
Let us show you the positive impact we can have on your ability to provide safe and cost-effective healthcare.
It is what makes us a resource.
In April 2005, Jeffrey W. Henderson joined the firm as a Chief Financial Officer, CFO. R. Kerry Clark was appointed President and CEO on April 17, 2006, with Robert D. Walter retaining the chairmanship. On September 29, 2008, the company announced Kerry Clark would retire and George Barrett would become the chairman and CEO. In 2007, Cardinal Health recalled ALARIS infusion pump model 8100 due to misassembled oligoder springs that would cause patient to be over-infused, which could lead to death. According to a consent decree with the FDA had issued warning letters to Cardinal Health around quality control issues in their supply chain. In 2009, Cardinal Health and the FDA agreed to amend the consent decree to have a thorough independent review of its product line and devices. In 2008, Cardinal Health agreed to pay $34 million in civil penalties to settle DEA allegations that it failed to report suspicious odor of hydrocodone, a potent painkiller. The fine followed a 10-month DEA suspension of a Lakeland FL distribution facility and 2 others in New Jersey and Washington. On February 2, 2012, the Drug Enforcement Administration again suspended the license of the firm's Lakeland, Florida distribution center to distribute controlled substances on charges that it had followed 4 Florida pharmacies to purchase excessive amounts of controlled substances, in particular oxycodone. As an example of what the DEA is trying to halt, according to the Justice Department, last year Cardinal shipped enough oxycodone to pharmacies in Sanford, Florida that could supply a population 8 times its size. Sanford has a population of 53,000 and the supply would support 4 lakhs. Cardinal obtained a restraining order against the suspension so they could continue to sell painkillers in mass quantities to targeted pharmacies, but the suspension was upheld on February 29 by a federal district court because the court agreed with the DEA that Cardinal's activities represented an imminent danger to the public. The company asserted that it has blocked 2 of the pharmacies, Brooks Pharmacy in Bonita Springs, Florida, and Gulf Coast Medical in Panama City, Florida, and notified the corporate owners of the 2 pharmacies that were part of national chain to CVS stores in Sanford, Florida. In 2010, the Florida State Medical Examiner's Office recorded 4,048 deaths from prescription opioids, up 24% from 2009. So student, we got to know about the various aspects of Cardinal Health. Hope the information was useful to you. Have a lovely day ahead.